Okay,
Thank you for your time, and look forward to hearing from the group.
okay, we'll stay on a bit past our 1 o'clock planned ending time because there are quite a number of questions, and one of the ones that came across most frequently is recognizing the fact that you're not a medical doctor and you don't see patients in a clinical setting. Based on your observations and your experience with patients who have both primary orthostatic intolerance and also CFS, what management strategies have you found that can help people minimize and cope with these disabling symptoms?
Well, as you point out, you know, and as I've alluded to, we have a vast clinical experience, and I'm not giving out medical advice by suggesting the strategies that we have found useful and that many people have reported to us as being useful. One is maintaining your blood volume as best you can by drinking lots of fluids, and I know many individuals derive benefit from drinking water. Eating salty foods, and maintaining their blood pressure. We generally suggest the use of compression garments if and when appropriate. Jobst makes compression garments and you know, surgical stockings and such. Many sports clothing manufacturers make spandex lycra tights and leggings, and if you one of the things, as I mentioned, that happens is you get a vertical displacement of fluid from the chest downward, and certainly if you wear compression garments, it mitigates that. It helps to alleviate some of that, and many subjects have found symptomatic relief in doing something like that. There's been a lot of interest lately in the benefit of exercise, and some of our colleagues have reported benefits from mild or moderate regular exercise, and I know it's a double-edged sword because most subjects with chronic fatigue syndrome simply can't do any exercise, and the secondary effect, as many of you know, of doing exercise is you get that rebound excess fatigue following exercise. So what we recommend is that people start out slowly, perhaps doing a little bit of walking, doing something like a bicycle or a recumbent bicycle, so as to minimize the effect of standing up and doing things, and to start slowly and try and incorporate exercise in a slow, graded fashion. Beyond that, your physician might want to consider using some agents that act at the level of local blood vessel control, but as stated previously, I'm not licensed to make those sorts of recommendations.
I'm going to put out a poll here while we
Okay.
move on to another question, but there were several questions about conditions that might coexist with CFS and also with different forms of orthostatic intolerance, like migraine, let's see,
Yeah, what?
Raynaud's.
Yeah. Well, I'm not sure what the relationship is with Raynaud's. Certainly we've seen a number of subjects who come in symptoms of orthostatic intolerance and or chronic fatigue in whom we've seen Raynaud's. What we typically see, what we see more often and quite regularly, is when we tilt people, their lower limbs become purple, suggesting the pooling of blood locally. So we see that. We certainly see our share of subjects with gastrointestinal complaints, very, very common, and perhaps the most common comorbidity that we see is the reporting of headaches and or migraines. These are commonly seen together, and if somebody comes into our practice and mentions any or all of these symptoms, we're seldom surprised because we see it in a large subset of our CFS patients. It's the rare CFS patient that doesn't have a lot of these associated symptoms. What they're caused by, unfortunately, we don't yet know. I guess that's all I can say to that.
Okay. How about cardiac insufficiency, heart failure as a major complication? Do you see have any evidence for the existence of those things concomitantly with CFS or orthostatic intolerance?
I don't know what the demographic of the audience is today. My guess is that they are somewhat older than our subjects. We, Dr. Stewart and I, are part of the Department of Pediatrics, and most of the subjects that get referred as primary patients to us for the evaluation of chronic fatigue or of orthostatic intolerance tend to be somewhat younger than the general public, and usually are in their late teens or early 20s. As a result of that, the incidence of cardiac insufficiency and heart problems is virtually non-existent, which is not to say that there aren't teenagers and adolescents with primary cardiac problems, but the study subjects that we're allowed to investigate cannot have any underlying cardiovascular problems. That makes them ineligible for our studies, so the subjects that we see do not have any coexisting cardiovascular abnormalities. In fact, one of the inclusionary criteria are that they have to have normal cardiovascular function. As to the incidence of cardiovascular problems in subjects with chronic fatigue, I can't speak to that.
Okay. There are a few questions from people who wanted to know if you're still recruiting patients for this study or other studies. And
yes, we are. Our study is still open to recruitment. If you are interested, I believe there's a link to our study recruitment on the CFIDS site. I believe that's the best way to gain some information.
Yes.
If you would like to contact Kim, I can actually give you my email address. It's Marvin. I'm sorry.
Go ahead.
Go ahead, Kim.
I was just going to say we'll include the link in the follow-up message that
that's fine.
goes out after this program, so people
that's
can see
fine.
your study and the other ones, because Dr. Shungu is still
Great.
enrolling for his study as well.
Yeah, howling's a good word. You know, just as an aside for the people who are still signed on, one of the really terrific, from a personal and professional point of view, I'll editorialize now that the slides are no longer being flashed in front of you. One of the great things that the CFIDS Association has done is they've organized several really high-powered, intensive, scientifically rigorous meetings where people from many disciplines, different disciplines, get to share their perspective on this and other related issues. And they've done a tremendous job in fostering collaboration and integration of many different fields, all designed towards coming up with answers about chronic fatigue. So that's my way of saying thank you to the association, and I just wanted to make sure that the participants today can appreciate that as well. Yeah, Kim will provide you with my email address. What I will do following receipt of any of your questions is I may or may not get back to you very quickly because I'm actually going out of town for about a week and a half and will be unavailable via email. But when I come back, what I will do is I will review them with my colleague, Dr. Stewart, and if appropriate, I will forward them to our research nurse coordinator, Courtney Turilli, who may then get in touch with you for consideration of participation in either my study or some of Dr. Stewart's studies.